Hi again, thanks for staying tuned. Please meet my friend, Olivia. Olivia created ScreeningWizard after learning about the GLAD PC guideline that, in screen-positive patients, PCPs should assess for comorbidity and collaboratively make a care plan with the patient and family, and that better detection and triaging of adolescent depression and suicidality was necessary to give caring and passionate providers like you the ability to recommend the most optimal referral. Thanks, Melody. I'll take it from here. We would like the ScreeningWizard study to be implemented in up to 2 phases at your CCP location. You have the option of participating in any or all these phases. Here's what we have planned, but we are always looking for feedback on what might work better or what doesn't work at all in the context of your daily work routines with patients and families. ScreeningWizard aims to assess depression and suicidal risk and offer decision support for appropriate mental health referrals. The ScreeningWizard will use a decision tree that guides the system to produce an output of recommendations and talking points for a pediatrician to engage a patient and family in a referral to mental health care based on their treatment preferences, barriers, and readiness. During the first phase of the iTunes research that Melody explained earlier, we will provide tablets to the front office staff to log into, and then provide to every parent present for their adolescent's well visit. We plan to enroll 50 eligible parent-teen pairs. The parent will learn about the potential study and have the option to choose opt-in or opt-out. If the parent opts in, they will answer questions about the treatment preferences, depression knowledge, and their teen's functioning in daily life. If the youth chooses to opt in, they will be given a series of adaptive questions so the ScreeningWizard can determine their level of depression, functioning, and treatment preferences. The family's responses will print out on a 1-page report. Example report here. On printers provided by iTunes. The research assistant will facilitate getting the report to the provider or work with your practice on the best way to get the printout to the patient's provider. From that point of receiving the ScreeningWizard printout, the provider may choose to use the guidance and talking points to recommend the appropriate mental health referral. Each CCP practice will be assigned randomly to a time when they can start implementing iChart interventions as a whole over the course of 15 months. This is called randomization. This means that rollout of the intervention for all patients will occur at one time for each practice. Please stick around to learn more about the next 2 studies in the iTunes Center from my friend Bryant.